we are here talking about heart sounds. Now under this lecture we'll be talking about S1, S2, S3, S4. Along with this we'll be discussing about ejection click and opening snap also. So without delay, let's move into our discussion. So the first diagram, okay, here we are discussing all schematic diagram. So the first diagram that we are going to discuss is what is this? This is our atrial systole. Now here atrial systole, that means contraction of atrium, right? Now here, because of contraction of atrium, the blood is flowing from our atrium to ventricles. Now because of high pressure within this atrium, there is opening of these valves. What are these valves? These are our tricuspid valve and mitral valve. That's all, right? Okay, now as I've already mentioned, there is flow of blood from atrium to ventricle. Now here, these about 30% of filling of ventricle occurs because of because of our this atrial systole, whereas 70% of filling of ventricles, remaining 70%, it is because of rapid filling phase. Okay, now after these, what will happen? After these, there will be less volume of blood within this atrium, right? So there will be there will be less pressure also. Because of less pressure, what is this? This is our tricuspid valve and mitral valve. They will close. As they will close, there is our first heart sound, that is we mentioned as M1T1. Why M1T1? Because first heart sound, right? Mitral valve and tricuspid valve closure. Okay, the first heart sound is because of mitral valve and tricuspid valve closure. That's all. Now as there was flow of blood from this atrium to ventricles, there is large amount of volume of blood within this our ventricle, because of which there is pressure, large amount of pressure, right? Large amount of pressure. But this pressure within this ventricle is not enough to open these two. What are these? These are our two. Okay, let me mention right here. What is this? This is our pulmonary valve, and what is this? This is our aortic valve. Okay, there is increase in pressure within these ventricles, but these are not able to open these valve, right? So this phase is called isovolumetric contraction, constant volume, but there is contraction systole going on. So now let's move into another diagram. In this diagram, what we can see is that there is excessive contraction within this ventricle, right? What is this phase? This is our ventricular systole, ventricular contraction. Now because of excessive contraction, what will happen? There will be opening of this pulmonary valve. Okay, what is this? This is our pulmonary valve is opened, and here our aortic valve is also open, right? Now because of this opening of these two valves, there is another sound. What is that? That is our ejection click, right? Ejection, that means ejecting blood out of our heart. So the name is ejection sound. So why there is ejection click? It is because of this aortic and pulmonary valve opening, right? Opening. Okay, now ejection click. Okay, now another phase is that as there will be excessive flow of blood from ventricles, what will happen? There will be less amount of volume, less amount of pressure, because of which this pulmonary valve and aortic valve, they will close. Now these pulmonary valve and aortic valve, right? This aortic valve and this pulmonary valve, because of closure of this aortic and pulmonary valve, there is our S2, second heart sound, right? Second heart sound. Now we mention it as A2P2. Why we mention it like this? Because initially there is closure of aortic valve, right? Aortic valve, and then after some time, what is that time? That is about 30 milliseconds later, there is closure of our pulmonary valve, right? So since there is a gap between this closure of aortic valve and pulmonary valve, right? Initially there is closure of aortic, so we are mentioning it at the front. So the time gap is 30 milliseconds. So this time gap, it is called splitting of second heart sound, right? Splitting of second heart sound. Okay, now as we have said that there is closure of these two valves, but there is filling of blood within our atrium, right? Atrium. Okay, there is process going on to allow this atrium to fill with blood. So here, since this atrium, it is in diastole phase, relaxation phase, so this phase is called isovolumetric relaxation, right? Isovolumetric relaxation. So now moving further, as you can see, because of excessive flow of blood into this atrium, again there will be opening of this mitral valve and tricuspid valve, right? As you can see right here, right? Mitral valve and this tricuspid valve. Now here, because of opening of this tricuspid and mitral valve, there is another sound, that is opening snap, right? And it is because of mitral valve and our tricuspid valve opening, right? So because of closure of two sound, right? Because of closure of two thing, what is that? Because of closure of two type of valve. One tricuspid valve. Okay, in the case of S1, there is closure of closure of mitral valve and tricuspid valve. But in the case of S2, we have closure of closure of our aortic valve and pulmonary valve. But other two things like ejection click, it is because of what? It is also because of opening, and our this opening snap, it is also because of opening. Our this ejection click, it is because of opening of what? Our aortic valve and pulmonary valve, right? And opening snap, it is because of opening of mitral valve and tricuspid valve. Okay, so that is another thing we need to know. And okay, now since the systole phase, right, since from S1 to S2, as you can see, from S1 to what, our S2, right, S2, there is what, there is going on, systole phase is going on, right, as you can see, systole phase is going on. So this, from this S1 to S2, what you can say, there is, this phase is what, this phase is under systolic phase, right, systole, under systole. Now talking about S3 and S4. Now talking about S3 and S4, the thing that we need to know here is, okay, S3 and S4, what are these? These are what? Low pitch heart sound. Now what are these low pitch heart sound? These are low pitch heart sound, but other all our this S1, S2, everything except these two, and another condition is also there, that is what, we'll be mentioning it later on. Now these two, S2 and S4, these are what? These are low pitch, low pitch. Now what is significance of it? The significance of it is that in stethoscope, with the help of that small diameter having part, that means the front one, it is diaphragm, and the back one, smaller diameter part, it is bell. So these sound S3 and S4, these are low pitch sound, and these are heard with the help of bell, right, bell. I'm talking about this S1 and S2, these are heard with the help of what? With the help of what? Our diaphragm of stethoscope, and these are high pitch sound. Okay, not only this S1 and S2, also ejection click and opening snap, these are also heard what? High pitch sound. So that's all. Now talking about S3. Now what is this S3? S3, it is, okay, as you'll see, S3, we have mentioned this S3 after S2, or we can say just after what? Opening snap, right, S2. And if you'll see S2 properly, then what you will see, S2 is the phase after ventricular systole, right, ventricular systole. That means after ventricles, after the contraction of ventricles, there is what? There is S3. So this S3, it is also called ventricular what? Gallop rhythm, right, ventricular gallop rhythm. And this is heard mainly in the case in which the heart is in rapid ventricular what? Filling phase, right, during the time of high turbulence. So this S3 is heard at such a condition. And talking about S4, right, now if you'll see carefully, S4, right, S4 we have mentioned right here. That means it, after this, right, after this, there is what? There is S1, right, S1. That means S1, it is related with what? The S1, it is closely related, it is after atrial systole, right, atrial systole. So this S4, it is mentioned as what? It is mentioned as atrial gallop rhythm, right, atrial kick. Okay, now this S4 is because of excessive force generated by left atria, and it is heard what? It is heard after or during the phase of atrial systole. So talking about S3, as I've already mentioned, that it is what? It is just after ventricular what? Systole. So it is ventricular gallop rhythm. Talking about S4, it is what? It is related to what? Our atrial systole. So it is what? It is called atrial gallop rhythm. So this was what this was about. This was about S1. After S1, we have got what? We have got ejection click. We have got S2. After S2, we have got opening snap, and then S3, and then S4, right? Now this much phase, these are under systole, and these are under what? Diastole, right? Okay, same thing is mentioned right here. As you can see, S1, after S1, we have got ejection click. S1 is because of closure of what? Because of closure of tricuspid and mitral valve. Ejection click is because of opening of aortic and pulmonary valve. Talking about S2, it is because of closure of aortic and pulmonary, right? Opening snap, it is because of opening of what? Opening of mitral and tricuspid. Similarly, S3, it is what? S3 is heard because of what? A rapid ventricular filling phase, right? Rapid ventricular filling phase during turbulence. It is called ventricular gallop rhythm. Talking about S4, it is called atrial gallop rhythm, right? Atrial gallop rhythm, and it is what? It is because of what? Because of what? Excessive force generated by left atrium, right? And after S4, we have got again what? Again S1. Okay, now talking about what? The phase, the hemodynamics, we have got systole right here, and between S1 and opening snap, as you can see, sorry, between S2, right? What is this? This is our S2 and our, what is this? Between S2, okay, between S2 and opening snap, that means between this S2 and opening snap, what is going on? IVR, right? IVR, isovolumetric relaxation, the same thing. And okay, now S3, it is because of rapid ventricular filling, right? High turbulence. Okay, now what? diastasis is going on. Diastasis, what is this diastasis? It is the phase in which the heart is what? Heart is completely in what? Heart is completely in rest position, let's say, right? Relaxing condition. And then again atrial systole will take place. That means S4, again after S4, S1 will occur. So this was all about what? This was all about heart sound.